Just like with partials, the denture appointments are going to look a little bit similar. So you're going to start with the appointment 1 with the records where you're updating medical and dental histories. You're taking preliminary impressions. More than likely at this time, the teeth have either already been removed or they have been missing for several years. There's a couple ways that we can do a denture. An immediate denture is something that is placed immediately after the extraction of teeth. An immediate denture isn't going to consist of the amount of steps that regular denture fitting would take. It's going to usually consist of impressions that are taken, final impressions, and then the denture is created from there. With an immediate denture, the lab technician is basically having to guess where the teeth need to be placed because obviously the teeth are not missing yet. An immediate denture is something that once the teeth are extracted, it's then inserted into the mouth and it sort of acts as a bandage to control the bleeding. But it allows the patient to immediately go home with teeth in their mouth. And this is done for those patients that maybe have a job where they're having to deal with the public that they're not able to be without teeth for several months. In a traditional denture appointment where we're creating a whole new denture, like I mentioned, either for somebody who has allowed for healing time or has been a dentalist for a number of years, it's going to consist of those preliminary impressions. Again, there's no need for x-rays. They may take a pano if it's been a while just to ensure that there's enough bone level to accommodate a removable denture. And from there, preliminary impressions are going to be taken, again, either with alginate or they're going to be scanned, depending on what that facility uses. And instead of using a regular tray that we would typically use for pretty much majority of the procedures that we're doing where we're taking impressions, an edentulous metal tray is going to be used. And the metal tray isn't as thick as the regular trays would be. It consists of basically, it's a little bit more flat because again, there's no teeth for it to have to go over, so it's just having to go over the gum tissue. Once the impression is taken, borders may be added. That comes in play with wax that might be used. If you need to extend the tray a little bit more, then you can certainly use wax to sort of go around the rim of the tray to make sure that you're going to be able to capture as much of the gingiva tissue as you need to make a really good fitting denture. Appointment 2 is going to consist of the final impression, again with an elastomeric, a polyvinyl siloxane type of material, very similar to how your partial was done with the final impression. And again, the reason we use an elastomeric type of impression material is it's just more accurate. Alginate, if it's not poured up right away, it can distort. Polyvinyl siloxane or elastomeric, we don't have to worry about pouring it. Once it sets up, then it's as hard as it's going to get. So it's definitely going to be a lot more accurate than your alginate impression. So then from there, what they're going to do is they're going to create a base plate, which is going to be constructed of primarily wax. And that base plate is, again, sort of a way to be able to try it in before anything is being done. At the third appointment, it's the try-in of the base plate and the occlusal rim. It's going to be assembled basically on an articulator. An articulator basically puts your upper and lower together. The prosthodontist is able to take that off and try it into the patient's mouth. And from there, they're going to get their measurements. They're going to look for vertical dimension, and that's going to be the space that's occupied by the height of the teeth, which is going to be a normal occlusion when the patients are just biting together. It's going to consist of the occlusal relationship or centric relationship, when the patient protrudes, when they retrude, any lateral excursion, they're going to want to make note of that. And the smile line, they want to make sure where the patient's smile line would be. Again, we want it to look very natural and not that it is artificial or it's an appliance. And the smile line is going to basically represent the area of the teeth that is visible when the patient is smiling. And of course, the canine eminence, they're going to look at that and be able to determine where those canines should be located on the denture, again, so that it makes it appear very natural. They're also going to make sure that the midline is going to be appropriate, and also make note of where that maxillary frenum and buccal frenums are going to be, and also for the lower, same thing, the lingual frenum, and also the facial frenum, and the buccal frenums are going to make sure that they account for that. So when the denture is made, it's not going to impede on those areas. And then, of course, looking at the teeth, checking the shade, and trying to determine what shape and size of teeth are going to be appropriate. The registration is going to be taken, and the bite registration is going to be for both the centric relationship when the patient's at rest, how they normally would occlude or bite together, protrusion, so when the mandible is jutted forward, when it's retruded, when the mandible is sort of back, and then also lateral excursion, which is going to be the side-to-side movement. We have to account for that. And then, of course, any other functionally generated path techniques, as the patient bites together, what that looks like, and making sure that the patient's, especially their bite, is going to be appropriate when they come together and they occlude. The appointment 4 is also going to be another try-in. This is going to be where it's basically in wax, and the teeth are in there in place. In the appointment 3, where it was just the try-in of the base plate and the occlusal rim, it was all just wax that was involved. There was no teeth obviously in there. But the try-in appointment is where they're going to start to kind of shape and festoon the tissue. Festooning is where they contour to make it look and appear like gum tissue. Remember, we said that the gingiva has somewhat of a stippled appearance, kind of like an orange peel, where it's very rough and bumpy. It has some kind of like looks like veins and arteries that are in there. So we definitely want it to look more natural when it's once it's been created. And then, of course, to kind of look for occlusion and all of that to make sure everything looks appropriate. There's no rocking of the appliance, that the teeth look good, the shade is what the patient is wanting. And then from there, we go on to the delivery, which is appointment 5, where we deliver the appliance. And again, we're doing the same thing. We're checking the occlusion. We're checking to make sure that it fits well, that the patient isn't having any irritation or rubbing anywhere, and if so, then we're making those minor adjustments at that time. And then appointment 6 is going to be the post-delivery, and again, either 2 to 3 days. Typically for a denture, we don't want to go longer than that, especially initially once we've delivered it, because we want to make sure that if they are experiencing any sore spots, that they are getting those taken care of right away. And again, to get a sense for how the patient is doing, we want to take it out, we want to look at it, we want to look at the gum tissue, we want to ensure that the patient is able to put the denture in and take it out themselves, and answer any questions that the patient may have at that time. So kind of the major differences between the partial and the full denture is the number of appointments. For a partial, it's 5, and for a denture, it's going to be 6. And again, it's all going to depend on the prosthodontist and what their preference is. You might have maybe additional appointments, or you might have less appointments, and it's also going to depend on the patient as well. So to kind of get a sense for how dentures are made, here is a video.
Dentures. They're often used as comic relief in movies and Pixar animated shorts. But they play a big part in the daily lives of about 20 million people in America. And it's not just older people wearing them. But how exactly are they made? Dentures have come a long way. This set took 2 fittings and was shipped between 2 locations before it was ready to wear. The first thing to know is that a full set of dentures has a flesh-colored acrylic base that fits over the gums. The upper portion covers the roof of your mouth, and the lower is a horseshoe shape that accommodates the tongue. Now that we know the basics, let's learn how dentures are made. First, a prosthodontist makes an impression to capture the patient's upper and lower gums. A thick paste gets placed into the patient's mouth for a few seconds. While the impression is still gooey, it's poured into a stone which acts as a cast. This cast is now a replica of the patient's mouth, which comes in handy during the final stages of creating the dentures. In the meantime, the patient tries on different sets of dentures to determine the size and color of their soon-to-be teeth. From there, the prosthodontist makes a few adjustments to the cast. Next, the cast of the mouth is sent to the lab where the dentures get made. Using the patient's cast as reference, the lab starts to create the wax version of the gum line. The teeth, made of acrylic resin, a material that looks very similar to real teeth, are set in place. Minor touches get made to the wax around the teeth, then get sent back to the prosthodontist. After the wax dentures are approved by both the patient and the prosthodontist for fit and look, they're sent back to the lab to finish the process. The wax is just temporary. It gets replaced by an acrylic, which is more aesthetically pleasing and realistic looking. The lab boils the dentures to get rid of the wax portions. Holes are indented into the teeth so the material can attach to it. Then, a machine called the IVO-base injects the acrylic liquid into the molds to stick to the denture teeth. The dentures are cleaned up and polished. They're now ready for the patient.